world is filled with chaos. You can either participate in it, or you can learn to calm it. The choice, my friends, is yours. So now, let's go and calm some chaos. Hello, and welcome to the chaos. Today, I'm going to be talking about something that's caused me some chaos in the last couple of weeks. I've had some interviews with Abigail Shrier, who's an author, and she's been talking about bad therapy and why kids aren't growing up. And when I saw the title of this book, it was interesting to me because I thought, why are you just attributing bad therapy to why kids aren't growing up? Therapy happens maybe 1 hour a week. What are the kids doing the rest of the days of the week? I don't know that bad therapy is the reason why kids aren't growing up. And specifically, Abigail Shrier talks about Generation Z, that they're just not wanting to make decisions and they're not wanting to grow up. If they are coming into my office or any therapist's office, they're coming in 1 hour a week. That's not a whole lot of time. Of course, yes, we do have influence over people and especially young people, but we also have the law and we have ethics to keep us in line. Ms. Schreier doesn't seem to appreciate that or mention it in her book. Now, this is not going to be, to cast a lot of shade on Abigail Shrier and her work. Truly, I do appreciate what she has tried to do and her hypothesis and theories and also the references in this book. Now, I have to make clear though too, I did not buy this book with my money. I have a very good friend who gives me Barnes and Noble gift cards. And yes, I used that gift card to buy that book because I didn't want to spend any of my money on it. But I did want to see some of the references and be prepared to just speak my mind about some of these things that she has to say. So this is not going to be a book review, but rather I'm going to air some of her clips from her interviews and respond to them. And hopefully in a respectful way. Because you know what? This whole subject of therapy and counseling and psychotherapy and the way that it should and shouldn't be done is pretty near and dear to my heart. And it makes me really passionate and fired up. So if you're ready to go on a journey of chaos with me and help me calm it, then let's go. So, the first clip I am going to be airing is from a podcast called Unheard. And I really like the host. And so, check them out. I will have a link to the full interview in the show notes. And I really do believe that this lady does an excellent job with her podcast. So, when Abigail comes on, she starts right away talking about things. And here's the first thing she discusses.
Bad Therapy, a new book that I have here by best-selling writer Abigail Shrier, argues that not only are there more American kids than ever suffering from mental illness, but the therapists they are seeing might be harming their patients more than helping them. It's a bold claim and certainly one worth investigating. So Abigail joins me live to talk about it. Welcome to Unheard, Abigail.
Oh, thank you so much for having me. It's great to be here. And I really am I'm thrilled to be talking to Unheard.
I've got to start with the obvious question, I suppose the critique that someone else might come into this conversation with, which is, are we surely not just seeing the result of discovering all of the people who historically, over the last few hundred years, where therapy was not so widely available, would have just been left to suffer in silence? Is that not a good reason for having this kind of boom in therapized young people?
So that's a really good question. We always need to ask when we see a correlation, the rise of treatment, the rise in treatment prevalence, the rise in accessibility of treatment, and the complaint malady, the disorder going up. We need to ask: is that just a coincidence? Are those two trends just coinciding? They happen to go together, but it's not that the treatment is ineffective or, as I argue, counterproductive. I don't think so, and here's why. I don't think it's an accident. There are a few reasons. First of all, whenever there's greater treatment in a population, greater accessibility for anything from breast cancer to maternal sepsis, with more antibiotics. You want to see the point prevalence rates of any disease, any disorder going down, right? We want to see, the incidence of depression or anxiety in teenagers going down because we know these kids are getting flooded with treatment. Instead, it's skyrocketing. So we know at the very least, it doesn't seem to be helping. And I'm not the only one to have noticed that. A team of researchers looked into this and they called it the treatment prevalence paradox about depression across the West. As people have gotten more treatment for depression, as it become more accessible and more available, rates of depression, especially in our young, have gone way up.
Well, therapists are only with clients 1 hour a week at most, some more. But when you think about all the other hours that people spend doing other things, like being on social media, interacting with friends and family, under the influence of TikTok, you know, blaming therapists for the demise of the young people, we really have a very small influence in their lives. So I don't get it at all. And I don't agree with it. I think that if there are bad therapists out there, therapists that are influencing people's thinking in a way that is not helpful to their therapeutic goals, yeah, I mean, that's wrong. So here I am going to show you what I do. And it's not the gold standard, but that's the way I'm trained with a treatment plan and an action plan. And oversight happens with the Department of Health. They are the ones that govern my licensure, and with the American Counseling Association. They are my ethical standards.
Because researchers have looked into what are the common side effects of psychotherapy. We know that any intervention with the potential to help also has the capacity to harm. And that's true from everything from Tylenol to x-rays. If it has the potential to do anything at all, by definition, it can also harm. And that's true of psychotherapy too. And the known harms of psychotherapy include things like making anxiety worse, making depression worse, a feeling of inefficacy, like I can't do for myself, a feeling of demoralization. Gosh, I'm limited by this diagnosis. I can't possibly lead the life I want to live, and alienation from family members. All things that typify this generation, which is also the most treated generation. So that's the beginning of why I started to think this isn't an accident.
Yes, it is true that therapy can harm people, and we disclose that though. In Washington state, and I believe in other states as well, we are required to let people know the benefits and risks of counseling. It's actually put forth in the Washington Administrative Code and the Revised Code of Washington. We include that in our disclosure form. So, there's not this big conspiracy going on here, Abigail. What we're doing is we're trying to do our work, and we're trying to do our work effectively. Now, that being said, if any therapist out there is not adhering to the WACs and the RCWs, you need to stop it and you need to correct yourself. All right. So, yes, we need to have full disclosure, telling people what we can and can't do. And we also need to abide by the law and the ethics.
Start the book by separating between two groups of people: the severely mentally ill, those with a real mental disorder who are undertreated and underserved, certainly in America, by a large margin. These people are not getting the help they need. And then we have what has been called the worried well. These people don't suffer in a profound way. They are sort of the bummed out teens of the West. They're fearful, they're worried, they're sad, but they don't have major depressive disorder, and we're reluctant to diagnose them with that. There is an expansion in mental disorder in diagnosis. There's no question. Way more people, young people, are being diagnosed with things like ADHD, depression, anxiety, and whatnot. But mostly those aren't people who are profoundly hampered by mental illness. Mostly it's people who are a little extra worried or, but let's take the severely depressed for a moment. These are people whose lives are so profoundly affected that they can't get out of bed, that they are truly suffering in a way that they can't function otherwise. That is not the population I'm talking about. Those people need all the resources we can give them. But mostly, I'm talking about people who just feel like they need a mental health day off work. They don't even usually say they have mental illness, although these young people are quick to state their disorder, but they'll just say, I need it for my mental health. Not that I have mental illness, but that this would be good to boost me. And that's what we're doing. We're assigning preventive care, so called preventive care, which has never worked successfully in mental health, preventive care to a population that is well.
You know, I get that there are some people who are really, really very, I mean, they're psychiatrically ill and they need help. And fortunately, there are facilities for that. Mostly, it does depend on medication management. When there is therapy, though, when there is talk therapy or interventions that we can do, like CBT, DBT, ACT, and EFT, all that stuff that we can do, we do the best that we can. So I don't know why you're dissing on us, Abigail.
I'm not minimizing the actual conditions which people do have. What I'm saying is, we aren't all, I'm disputing the idea that we're all a little mentally ill. Now, it is true that the rising generation describes themselves that way. They seem to believe we're all on this big continuum of mental illness where the serious schizophrenic is on one side and I'm just a little to the right of that. That's actually not true. Schizophrenia is a profound illness that is very difficult to deal with, and the bummed out teenager doesn't have a little bit of it. Do kids need support? All kids need support, of course, including kids who've been through something very traumatic. They may need special kinds of support. There's no question, depending on what they've lived through. But two things. One, should we presume that most kids will be traumatized by a tough upbringing? No, actually, we should presume the reverse. Most kids are remarkably resilient in the face of adversity. Two, is there proof that kids who've been, say, physically abused are more likely to abuse their own children? Actually, no. In prospective studies, meaning forward facing studies, which are the only rigorous ones, where you start with the kids where they're children. Kathy Wydham did this, a wonderful researcher. She started with the kids who were actually children. She documented their abuse, so we have proof of it. And then she caught up with them 15 and 20 and 30 years later. And it turned out they were no more likely to abuse their own children. And then the last thing is, well, let's assume some of these kids do need extra support. Is it best given to them in schools? And is what we're doing helpful?
I like what you're saying about resilience. I really do believe that kids have resilience and that we all should strive for resilience. In fact, one of the things I'd love to do is to say to kids, like, you have your own unique talents, strengths, and gifts that you can give to this world. Go out and do your good stuff. And that's what I've always tried to say with the people who have been on my podcast as well. And I think that if we were able to say that more often to our young people and get them to really be in tune with what they do well and how they can help shape and change the world, I think the world would be a better place. What about you, Abigail?
Let me just talk about therapy for a second. I wrote an entire book, obviously, about the irreversible damage, about the transgender epidemic, about teenage girls. And what I want people to know is, in almost every case, the girl who was sent to a therapist by her parents, not for gender dysphoria, but for anxiety or depression, in almost every case, the therapist participated and encouraged, the young teen's revelation that she was transgender. Because what they were doing in psychodynamic psychotherapy while they were exploring, the young girl's alleged trauma, when they were done talking about mom, they would move on to gender. So, how are you feeling about gender? And together they would come upon this diagnosis. So, before we even get to medication, there are very real ways in which therapy can make your problems worse or introduce new problems. That's what bad therapy is. A teenager who shows up in a therapist's office, it's because her parents made her. So the therapist has to work to get her in a way that she doesn't with a with that a therapist doesn't need to with an adult. But there's something else too. A child doesn't have the life experience of an adult. It's very hard for a child to say to an adult, listen, I'm not sure we should be calling my parents toxic.
How does patient therapist confidentiality work in the context of having a child patient? I've always kind of wanted to know.
I'm not sure I totally understand it because there's a lot of wiggle room here. I know that that patients that the confidentiality seems to be between the therapist and the child, but a lot of the information gets leaked to parents. Parents often use the therapist, and they told me this, to kind of surveil the child. Like, can you make sure nothing bad is going on?
So
She
kind of
won't talk to
helicopter
me.
parenting, but
Yes.
set to a
Yes.
thousand.
Yes, exactly. So often that seems to be how it's working in practice.
No, sometimes therapy can worsen a mental illness. And at the same time, when I think about it, as a therapist, I'm going to figure out and I'm going to see when my client is getting distressed. And I'm going to learn to back off and ask what we need to do differently. I don't know that she addresses this in any of her interviews or even in her book. That therapists do have this innate ability to be present in a room with a person and know when it's not safe to continue to push and when we need to back off and let them have their own process.
Now, remember, when you drop your child off to a therapist, the therapist's job is to be non judgmental. That's something we want as adults. We don't want a therapist judging our life decisions. We want help with the things we need help with. But with a child, dropping your child off for a non judgmental adult's assessment of her life, who might say, oh, you're having sex with, at 12, that doesn't seem to be like a good idea. You don't want non-judgmental with a child unless you absolutely need it again. And that's where the problem, that's where we're seeing so much mischief being made. A lot of parents who I wrote the last book about, who thought they were dropping off a very, anxious or nervous or sad teenager with a trusted adult. They thought the adult could just be trusted to sort things out for her. I don't think in almost any case, and I talked to almost 1,000 parents by the end, I don't think in any case I heard the therapist told my daughter, nope, you're not transgender. You're just 12.
You know, I like to believe that I am, in general, non judgmental. And yet, yeah, if a 12-year-old comes up to me and says she's having sex with somebody, that's against the law, actually. And I will have to let her know that we're going to have to, for her safety reasons, uh, we're going to have to try and let her parents know so that we can keep her safe. It's all about being safe, and there's no way around that. There is the law and there's ethics. You know, I don't know that most teens come into therapy because their parents want them to. Certainly, there are some of them, but many teens have contacted me because their parents have refused to get them therapy. They don't believe in therapy. They want therapy. These kids want therapy. And so when they come to me and the parent is always involved, I always ask, well, what's the problem? And what's your functioning? And what's your goal? And here are some ideas. It's really not that difficult. I can't emphasize that enough, you guys. I mean, that is what I am trying to say. It's not that complicated. There's the law and there's ethics. And if you're a counselor in any state, you're going to need to have ethics training, continuing education in ethics, continuing education in suicide prevention. You're going to have to adhere to these things. If you're not, you need to do it. There needs not to be bad therapy out there. This book is very upsetting to me because it does shed light on the fact that there are bad therapists out there. Please don't be one of them.
It's weird because as a parent, like you want to hear kids out. And when they're having like some sort of anxiety and issue, You want to talk with them and you want to talk through it and you
Sure.
want to give, you don't want to tell them, hey, you're going to have to suck it up. I never say that. And I probably should. I mean, I don't know if I should. But I mean, if I had boys, I probably would. I think I would probably treat them differently. But I think that there's there's a fine line. Like,
Yeah.
where is the point of diminishing returns? Like, where is it valuable to address feelings and anxiety and thoughts? And is it irresponsible to do so without giving them tools to mitigate those things? And along with those tools, to explain to them that there's things that they're going to have to do in this life that are very difficult,
Right.
but that there's a great reward in doing these very difficult things.
So the problem, as I see it, is not that you're not saying suck it up. It's that no one ever says suck it up, no matter how minor the scratch to these kids. Okay.
Mm,
And sometimes being told you'll live. Remember when
yeah.
dad used to say you'll live,
Uh huh.
or, shake it off? We never hear shake it off anymore. No
Hmm.
one says it. So they don't know they can overcome even minor injuries. And the truth is, they can.
Joe Rogan is a very interesting character, and it's been interesting to, react to him. And, he's not as intimidating as I thought it was. So suck it up. You'll live. Shake it off. The reason why these things aren't said anymore is because they're invalidating. They don't validate a person's emotions. Now, I'm not saying that validating is enabling, but I am saying that you can understand a person's emotions and then lead them to the truth and a solution to what they're going to do with those emotions. It's a balance. It is not this way or that way. It's not just suck it up, buttercup, or it's not just, oh, what can we do to enable you? There's something in the middle that people have to realize, and it's different with every kid. So, do you care about your kids? If you do, then you're gonna figure out that balance.
Did you talk to therapists when you did this?
Yeah, a lot of therapists.
Yeah. How many of them agree with you?
So there was a huge split. The academic research psychologists overwhelmingly agreed. They were aware of the literature and they said, yeah, these are bad practices. Here are things we shouldn't be doing with kids. What was interesting is a lot of the clinical therapists were either minimized the risks of therapy or denied that there were any.
Mm. But isn't that like Jiffy Lube? Like when you tell them you don't need to change your oil that much. Well, it's their business to change oil.
Right. Exactly. Exactly. So, like, I talked to this one amazing, child psychologist who said to me, I start by having my patients sign a waiver in which they acknowledge that there can be risks. And the reason I would do that is because I don't want them to experience harm. So, if they see that their worries are getting worse, they have to tell me.
No, she takes a little bit of a shot at clinical therapists here because, oh, the researchers and the psychologists here, they agree with me, but the clinical therapists, they push back. Well, you know what? We do. And the reason that we do is because we are the people who are out there in the trenches treating these people, doing the best work that we can. And the people who aren't doing the best work that they can do better. All right. This is why we have continuing education. This is why we have oversight. This is why we have the law and ethics. And we have people who can complain about us. And we are under a lot of pressure. I don't think that she realizes that. I don't think that she realizes how much pressure we're under. And I think that the world kind of needs to do that. When I think about the president of the United States, they don't have nearly the accountability or any kind of oversight that we have. We have so much oversight. I really think that she's doing us a disservice here. I don't agree with her right here.
I mean, it seems like the therapist is the one who's in control, right?
Right.
The therapist is the expert. They're the one who has the authority.
Right. Well, I mean, this one was Camilo Ortiz was one of the, he was the one I talked to, and he was the one that I was referring to there. And first of all, he always starts a therapy by setting the number of sessions. It's not he doesn't treat a kid like an annuity. You're going to, be my income stream for years.
Right.
He attacks, and also they come to him with an actual problem, like chronic bedwetting, like, various kinds of phobia.
Mm-hmm.
There are people who treat anorexia. They're tackling a problem.
Right.
And some of those therapies are extremely necessary and very successful.
Um, when this person that you were just describing, if they get someone that comes to them that doesn't have a real problem, do they turn them away?
Well, you can ask, but very often therapists don't turn them away. That's the problem.
Right.
Too many therapists. I mean, I saw, I think back to the first book, and I would ask, like, did anyone have a therapist who said, you know what? I don't think the trans identity fits you.
Right.
That doesn't seem to make sense to me. On almost no cases did the therapist stop a girl from going down that road. No, you don't have gender dysphoria. Listen, it's mostly little boys. Also, the incentive is for therapists to treat the least sick for the longest period of time. That's the incentive.
Yeah.
Because you don't want the schizophrenic patient who really needs you.
Right.
They're really hard to treat,
Almost impossible.
almost impossible, right? You don't want the bipolar patient.
Right.
Some people will refuse to see those patients. But a teenager with a little social anxiety, parent pays on time, they're not getting violent in your session.
Oh boy. Wow. I never really considered that until your book. Until I heard the title of your book and I read the synopsis of it. I never really considered it. I never considered that thinking about your problems all the time and talking about your problems all the time literally make the problems grow.
That's right. I mean, it's the number one symptom of depression is what they call rumination, this pathological obsessing
Mm,
over your pain.
yeah.
That's why stuff like exercise, that's one of the reasons, aside from chemical reasons, one of the reasons that doing anything, that running errands is good for your mental health, getting out of your house and accomplishing anything
Yeah.
is good for you. But sitting around talking and thinking about your problems, that's a bad habit. And the best cognitive behavioral therapists and others, the dialectical behavioral therapists, the ones who do really well with depression, the first thing they do is try to break that bad pattern. But a lot of therapists just indulge it. We should be telling kids is that the amazing story of human history is of resilience. It used to be the case that people lost a sibling. That was common. People lost a parent. That still happens, right? These things still happen. And the amazing story of human history is that doesn't mean it's not painful, but of resilience. They get on. They aren't permanently suffering with mental illness or mental problem. They form families. They are responsible in their jobs. They show up for work. They can be depended on by their friends. That's the story of human survival and resilience. And unfortunately, we're telling kids, no, you've had trauma,
Yeah. Yeah. You've had trauma and you need to work through that trauma.
right?
It's not just, this is just a part of life. And, what you need to do is just go out there and live your life and you'll get over it.
And, you know, the thing is, the truth is that most kids and most people did. In other words, that didn't mean that dad didn't lose his job and they were forced out of they had to lose their house or these things happen. They've happened in every family. And I think one of the many reasons that kids don't know this today is we've cut them off from extended family. The story of their grandparents is a story of resilience in almost every case, right? You hear about your family history and you're going to hear a story of pain and survival and resilience and overcoming. But today you've got teenagers who say, "Oh, I can't drive past my middle school where I was bullied because of my PTSD." They don't have PTSD, but they think they do. And actually,
What do they have though? If you are bullied, that does have a significant psychological effect on kids, and it can lead to lifelong depression.
I don't know that it can. I mean,
You
no,
don't think so?
sorry.
Like for young people that like get treated like shit and told that they're nothing and useless, and that sort of like when I didn't really get bullied in high school, but I remember going back towards my high school when I was like 19, and I'd get anxiety.
Right.
I'd get weirded out by it,
Right. So let me
because
just say, yeah,
you start feeling
yeah,
like you used to feel when you went there.
absolutely. But that's not a PTSD flashback, right?
What is that?
That's a bad memory.
I do agree that resilience is possible and that everybody does have resilience. In fact, I like to say that kids, adults, everybody has unique talents, strengths, and gifts that they can give to this world. And I really want to see that in the future. I look forward to seeing that in the future. I want to help people to get there. I think that books like hers can really challenge our thinking about being therapists, about being better therapists, so that we can actually help people and not hurt them. So if you're a therapist out there and you're hearing this message from Abigail, from me, from Joe Rogan, from Unheard, please be a better therapist. Be the best therapist that you can. Remember the ethical principles: autonomy, non-maleficence, doing no wrong, beneficence, doing good, justice, fidelity, veracity, to tell the truth. These are our ethical principles. And like it or not, when you are a counselor, you adhere to them. And if you don't, you run the risk of having a complaint lodged against you. If you want that, great. I don't. I do my best. Thank you so much for listening. I appreciate you. And may all of your therapy be good therapy. Thanks for joining me on Calming the Chaos. If you've calmed your chaos today, then that's great. And if not, well, there's always tomorrow or the next day. Thanks for listening, and take care.